Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you have requested. All four quadrants are the area of interest. Starting with the top right quadrant, we've got a upper right 7 grossly radius BDRs with a uh, area of maxillary. We've got sinusitis, maxillary sinusitis present here as well. When the roots are going to be extracted, the ridge width is approximately 13 millimeters and the height is 9 millimeters. If it's grafted and implanted later on, because immediate implant is definitely not possible. This is the mesial root, D3 quality bone around it, and this is the distal root. So definitely an implant is possible here once it is grafted. Now moving to the lower right segment, the lower right 7 and the 8 are the area of interest. So we're going to focus on the 7 first and then the 8 on the lower right side. So the lower right 7 again is a tooth which has a restoration. This is the mesial root. Both canals have been obturated. We don't have any radiolucencies on the mesial. Poor restoration because there's secondary caries underneath the crown. Here also you can see significant destruction in the crown structure. Poor obturation but no radiolucency can be observed here. If this tooth is in fact extracted, the area will have a sufficient bone. 11 millimeters of ridge width with approximately 19 millimeters of height. So immediate implant placement is going to be possible in the lower right 7. There is a horizontal impaction of the lower right 8. Fused roots for the most part at the apex. It separates as the mesial and distal. The mesial root is in very intimate close contact with the inferior alveolar nerve, while the remainder part of the lower 1/3 of the root apex is definitely in contact with the inferior alveolar nerve, and it's also fused to the lingual cortical plate. So this tooth should be extracted with extreme caution. Moving to the upper left segment, 4, 5, and 6. As you can see, the 4 is BDRs are present here as well. Again, glossy caries BDRs, 10 millimeters of ridge width with approximately 18 millimeters of height. Good D2 quality bone. So hence extraction followed by immediate implant placement is possible. Upper left, sorry, 5. Definitely costly caries has a periapical radiolucency with perforation in the cortical plate as well. So here we've got approximately 9 millimeters of ridge width and 13 millimeters of height. So immediate implant placement is going to be possible because of this lower 6 millimeters of bone, but buccal grafting will need to be done due to the lack of buccal cortical plate. The upper right 6 also has a bridge over it, so the pontic area, you can see you've got approximately 8 millimeters of ridge width and 8 millimeters of height. This is the 7, which is treated very well. So if it is removed from the bridge, in fact, it will stand alone independently work really well. The upper left 8 also is endodontically treated and no radiolucencies can be observed. Moving finally to the lower left 6 and 7 region. The lower left 6 and 7, you can see again, glossy caries endodontically treated, but no restoration can be seen. Mesial canals have been obturated, slight periapical radiolucency, and the distal canal also has been obturated. The distobuccal is very well obturated. Distolingual, however, is only slightly obturated with a periapical radiolucency. If this is in fact extracted, you've got 11 millimeters of ridge width and 18 millimeters of height. So good bone for immediate and delayed implant placement. The region of the 7 again has an extracted area, excellent bone conditioning, D2 quality bone, 14 millimeters of height and 13 millimeters, so 14 millimeters of width and 13 millimeters of height with D2 quality bone. Not an area of interest, but something that we've observed. The lower left canine is either fractured, has a J-shaped radiolucency, especially on the mesial aspect. So we're assuming this tooth definitely has a line or a crack, but you can see significant radiolucency can be observed in this tooth on the mesial aspect of the lower left canine. As you can also see, there is in fact a crack in this tooth. This is the axial view of the lower arch, and again, just to give you an idea of where the radiolucency is, it's right here on the mesial aspect. It could be periodontal in nature or could be associated with the lower left 8. We don't see a crack on the axial view yet, but we do see that there is in fact, a little bit of a shadow on the coronal part. But if you look at it from this aspect, we don't see any major cracks here. So this could just be a periodontal lesion. The lower left 6 also has a similar lesion, which you can see right here. Thank you very much.